Hey, my name is Kara. I'm an ultrasound tech, and let's talk today about why your LMP due date may be different than your ultrasound due date. Now, for those of you that don't know, your LMP is going to stand for your last menstrual period. And usually, this is how most women calculate about how far along they are in the pregnancy. You are going to calculate from the first day of your last period, and then from there, it is going to give you a estimate of how far along you are in the pregnancy. Based on that estimate, you are going to then schedule your ultrasound exam, and then at the ultrasound exam, we are going to scan baby and measure baby from head to bum to give an exact gestational age, which then corresponds to an estimated due date. Hopefully, I didn't lose you there, but let's just go ahead and rewind. With your last menstrual period, what is going to happen is we are going to calculate basically how far along baby is from there. This is going to only give us an estimation because periods are not always regular. And even if they are regular, we can't always count on the fact that ovulation was on day 14. And we also can't count on the fact that fertilization happened right at the time of intercourse or basically the day of intercourse. Sperm could actually live in the body for about 5 days afterwards. So there is a pretty huge guessing game, as well as there can be a pretty big discrepancy if a woman has irregular periods, and also if she's not sure when she ovulated, and also if she's not sure exactly when she would have conceived, as in what date she would have had intercourse on. So you can imagine then, with all of those variables up in the air when you are going by the first day of your last period, this is a pretty big range in dates that the woman can say she is pregnant in, and therefore we only have a ballpark of how far along she is, as opposed to the ultrasound scan that we do in the first trimester. What we are doing is measuring baby from head to bum, and that is a quantitative measurement. Essentially, it is something that we are measuring, and then based on scientific data, it will give us a gestational age, or how far along you are in the pregnancy. From that, we can then calculate an estimated due date. And I say estimated due date because there really is no way to tell exactly what day baby is going to arrive. But basically, we can get an estimation within about a month or so, I'm going to say. I've heard many doctors basically say that it is going to be plus or minus 2 weeks out from when your due date was estimated to be that baby could arrive. And really, the only way that we are going to predict when baby is going to arrive exactly is if you have a scheduled C section or a scheduled delivery. But even in those cases, baby could still just come on its own before that. But hopefully, now you guys can see why there can be such a big discrepancy with the due date that is calculated based on a woman's last menstrual period versus the ultrasound due date that we get. Sometimes there is even up to like 1 to 2 months discrepancy based on what the history is with the menstrual cycle, as well as a bunch of other factors, like, if the patient has PCOS, for example, that also will increase the chances that we are going to not really get an accurate due date with the first day of the last period that she tells us. And in the end, it also is really important to note that the ultrasound due date is going to be the most accurate. And after we do that first dating scan after 7 weeks in the first trimester, then we are going to use that due date and that due date alone. And that is not going to change throughout the remainder of the pregnancy. So even if you think that, let's say you are 12 weeks along based on your first day of your last period, don't go by that until you get a actual ultrasound dating scan, which will tell you exactly how far along you are. After that first dating scan, we are going to go ahead and basically scrap when the first day of your last menstrual period was. That's basically the only time that I personally only ask when the patient's first day of the last menstrual period was, because after that point, we don't really care in the nicest way possible, because then we have the due date generated by the ultrasound, and that is going to be the most accurate anyways. So if you guys have found this video helpful, which hopefully you have, please like and comment and subscribe as usual, and also follow me on TikTok. I make videos over there as well.